Hi everyone. I'm going to be standing here a bit closer to you. I'll explain it a little bit later why. But hi to everyone who's joining us online as well. Today I'm going to explain to you a little bit more on how probably it works in a hospital setting. Professor Tan has given us a fantastic data. He's given us fantastic ideas right there. And even though I haven't met him, I hope that my presentation just follows through on a lot of things that he has brought into us, right? So I'm just going to show, hang on, let's go back to this one. So we're talking about this improving staff well-being to improve patient outcomes. We are constantly open to newer ideas. We want to hear from you. We definitely want to hear from those people who are online as well. Any comments, questions that you have, so please do send it in. Those are my social media tags. Okay, few quick facts that we need to know about. According to WHO, there are 65.1 million health workers. In 2020, the global workforce stock was 29.1 million nurses, 12.7 medical doctors, 3.7 million pharmacists, 2.5 million dentists, 2.2 million midwives, yes, that's still a thing, 14.9 million additional occupations in and around the hospital setting, tallying to about 65.1. That's the latest numbers that we have. The current population of the world is 8.1 billion, which is a 0.91% increase from 2020. That's 1 year, right? That's key to remember the percentage rise. The population in the world in 2023 was 8.0545. Okay, and that was a regular 0.88% increase from the year prior to it, right? Now, the important thing to see here is 0.8% of the total world population of healthcare professionals treat 100% of the world. They treat themselves as well. You treat yourselves as well, right? Now, this incidence, of course, increases because of burnout at a facility level that we are all involved in, right? So it's important to remember that those are the fast facts that we have, right? Now, I'm going to share with you some possible solutions to how we can address this on a very, very practical space. Professor Tan alluded to a lot of things just now, really brilliant. I'm trying to hit it on the nail, right? Creating a joyful workplace. Yesterday, on one of our sessions, we were talking about having a just and a no-blame culture. Culture takes time to build. It takes time to build, right? It's not, we can all agree that it needs to be done, but it's going to take 3 to 5 years for our entire hospital setting, let alone our healthcare systems to integrate this and make it work so that the person who is the security guard at the front gate of the hospital, he feels it, right? Because he's the first person that patients see and interact with when they come in, right? So that's important. Decluttering as well as updating systems and processes. I really like what Singapore does because as a country, they review their laws, their systems, their processes, and they update it. I come from Malaysia, where our Healthcare Act is from 1971, right? It's 53 years. It needs to change because this Logitech clicker is probably 3 months old. My phone is 2 years old. My car is 8 years old. And so every technology that we have is changing so quickly. Our laws need to keep up with it, and our people need to keep up with it, right? We're using everything. I'm sure that a lot of people are your cell phones or even your laptops are probably less than 2 years old, right? So when we have the latest technology in our palm of our hands to use at our place of work that is so dated, we need to really look at that. adds to the stress and the burnout for staff, right? So decluttering means obviously looking at laws and systems and processes that don't need to be there anymore because you can update it. Prof. Tan was just alluding to the fact that the rounds for the medical officers going around 5 times, now they're cutting it down to 1. You understand? So the technology helps you. The preparation helps you. The experience helps you to get there and get to the same outcome as you want. Instead of doing it 5 times, you've done it once. You save time, right? Cut meetings, unproductive time, and focus on efficiency and effectiveness. This happens every time. I know I talk to a lot of people in different hospitals. I talk to a lot of people in different healthcare systems, and they all tell me, I'm very busy in meeting, busy in meeting, busy in meeting. What did you achieve in that meeting? Because you walk out of that meeting, you go to our next meeting. Walk out of that meeting, you don't actually do work. So we have to really think about, is this meeting necessary? Do we need 1 hour, or can we settle it in 10 minutes? It's a change of mindset, and you have to do that because there are a number of people who are involved in meetings, and you're just sitting there because you need to make the numbers. You need to be there for this meeting, but there is no input from you, right? And obviously there's no output, so you're wasting your time sometimes, and you're sitting down at the meeting on your phone, checking your Facebook or your Instagram, because whatever they're discussing doesn't really concern you. What I'm saying is actually what is happening in hospitals. It's adding to the stress. It is not reducing the stress. Okay, have clear avenues for issues to be addressed. One of the things in my private life, I work for a news portal in Malaysia. We started in 2020 in the thick of COVID, and we are now the 2nd biggest news portal in the country. But when we started that portal, we intentionally hired younger reporters and journalists. So my age group is hiring younger people, right? There's 2 different ways of communicating now. And I wouldn't say that our business in the news is as stressful as healthcare, but it is quite similar. Because number 1, we deal with politicians, we deal with everything. Okay? Number 2, we are always dealing with bad news. Because bad news sells. The first thing you open your newspaper is a plane crash, train crash, whatever, COVID numbers high, we are dealing with that. And number 3, everybody is lying to us. I'm telling you, everybody lies to us. They'll be, I didn't do it, he did it. He didn't do it, they did it. That is why, you understand, this is what we have to deal with. So, the job is very stressful, and we have a very young bunch of people. They are very talented, but they are very young. And we realize that us being older people, we do use harsh language or very curtly. We talk, hey, you made a mistake. And the younger people cannot take it. And Prof. Tan was alluding to it, the fact that the younger audience, or your younger staff, your younger colleagues, cannot take it. And we realized very quickly that the minute you say something harsh to them, they shut down. And they compartmentalize themselves. When you tell them something, they don't listen to you anymore. Because they look at you as enemy, not as friend. What I'm saying to you is actually practical stuff. So what we did was every Friday at 5:30, no matter how busy we are in the newsroom, we go to the pantry, we get a couple of bottles of whiskey, we take some food, chips, whatever. We invite people to come in. You come, you sit down. So no matter how senior you are, how junior you are, you can come into the room, and we do this every Friday at 5:30. And then the younger people suddenly realize, hey, I can talk to my boss. Huh? He doesn't hate me. I made a mistake. So he scolded me, he said something to me, but now I can sit down and talk to him. And then we build a relationship with these people, the younger people there, because they are smart, they are good, we hired them. Right? We hired them, but they are part of us now. And so they sit down with us and realize that no matter what happens from Monday to Friday, at Friday evening at 5:30, we can sit down and we can enjoy ourselves, right? And we talk to each other and have a frank discussion and find out what their father does, their mother does, whether they got girlfriend, whether they want to get married, I don't know. But we have those conversations to build a relationship. Because we were building a team. We were constantly building a team. What we did then was ensure a place is created to have stress relief, which is sitting down there. I know for some of us, you're looking at this and say, what is this, Manvir? You are asking me to set up a karaoke room, or put down a pool table, or to give somebody a gym membership, or even to put a TV there and put a PS5. But it allows them to get away from their work at work. You put a small room where they can just forget about work for a while, because the job that healthcare does is extremely stressful, right? You must obviously have access to counselors and psychologists, and discretion must be guaranteed. One of the issues that we have in Malaysia is if a junior doctor feels a bit stressful and they go and see a counselor or a psychologist, everybody in the hospital knows. Oh, this fellow a bit crazy. Oh, that lady a bit wacko. You understand? So that stigma follows them. So they are afraid to go. We need to figure out ways on how to have this discretion. In our earlier session, we were talking about doing this online, having an app for it, having all this available on their phones. Maybe that is something that you really need to look at, but having that access is extremely important. Now, I like to have this policy happening in every hospital. Is to send staff to conferences and seminars to build capacity. One of the things that you constantly need to do, Prof. Tan mentioned just now, this is evolving. In order to keep up with this evolution, we need to evolve and educate. And I don't know, for the people at home who are watching us on Zoom right now, you're not here, but this event in Bangkok has 6,200 people. And if for those of us here and physically watching this, you walk outside, people are smiling, people are laughing, people are dressed up, they are nurses, they are doctors, they're sitting down and laughing. There's so many little spaces here where you can take photos. Everyone's taking photos. Everyone is going to their poster in front and taking photo in it. There are guys videoing everything. This is a stress-free environment where you learn things. I love coming to conferences like this because I get to learn. I'm meeting people, I'm asking them opinions, I'm listening to ideas, and this is what we need to do for our staff in our hospital. Refresh them. Let them come out to places like this and learn something new, because the experience is there. I know doing it on Zoom is fine, but you're still in your environment, which could be stressful. If you're not in the house, you're probably in an environment at work. If you're at home, it may be more stressful if you have a couple of children and a dog running around. I don't know. You tell me. Now, we also need to have periodic town halls to ensure that people are aware of what's going on. What do you want to do? How can we do this better? Because the people who are on the ground doing the actual work are very important. Having team building activities, like Prof. Tan was suggesting, very, very good. One of the reasons why I'm standing right here in front of you is I don't want to be on a different level. I don't want to be behind these flowers. I don't want to create a barrier. I want to be there for you to talk to me and for me to talk to you very, very honestly so that we know these things. And we need to be open to having ideas and suggestions for improvement. Right? I'm going to end with this next one, which is celebrate wins always. Always celebrate your wins. Now, healthcare is very strange. Yeah? when you give people good news, you give people good news with a caveat. You will tell somebody and say, Miss, your cancer is gone. But, Mister, your blood sugar has lowered. But, and that mindset is constantly there because you don't celebrate with your staff. With your team, you need to celebrate those little wins, whether they're small, big wins or not. You need to celebrate every time your hospital wins an award or puts up a poster. Be proud of the people who are doing it. Our culture has been such, it's a very Asian culture. Maybe for people in different countries, you don't get it, but it's a very Asian culture that we don't celebrate the people who are doing great things. And the younger set of staff that is the next generation of healthcare. I say that again, it's the next generation of healthcare. The people who are in the 25, 30, 35, 40, that's the next generation of healthcare, who is digital, who needs that to move up. And whether you like it or not, I mean, like Socrates said, people are soft and so on, but we need to celebrate those wins. We really, really need to celebrate those wins. So, I invite you to ask both Prof. Tan and myself maybe some questions, whether you're in the room or in Zoom. We want to hear your ideas. Or maybe you want to tell us some of the things that you have done in your facility that has worked. That one thing. Because all of us here, we are trying to learn this, and then maybe you have one idea that worked for you. Share it with us right now. If you can get on Zoom with us, or send in the question, or even if you're in the room, people are smiling at me, so I'm expecting some ideas. Thank you so much.